Good evening, everybody, and welcome to the sixth in our series of practical climate action for Caribbean health professionals. Uh, this is an interesting session focusing on how to build alliances between people of faith, different religions, and health professionals for a better climate. The goal of this series is on equipping professionals with hands-on techniques, leadership strategies, and teaching tools for promoting climate action in different settings. And the organizers of this session are the Global Consortium on Climate and Health Education at Columbia University in New York, EarthMedic and EarthNurse. We're based in Trinidad and Tobago, and University West Indies St. Augustine campus. Today's session is a special session looking at how to build alliances between health professionals and people of faith for a better climate. It will explore how health professionals can engage with faith leaders and institutions and provide evidence-based knowledge to support climate education and resilience building. We will explore the moral and spiritual dimensions of the crisis, the climate crisis, underscoring the shared responsibility between religions and healthcare to protect all of creation, that is, both the people and the planet, and promote justice for the most vulnerable. Continuing medical education credits for Caribbean-based participants are available, and it's one CME credit available for this session for participants from the Caribbean. Application will be made by completing the CME link at the end of the session, and that link will remain live for 24 hours after the close of the session. And you must please use the same email that you used to register for the course in your request for CMEs. Tonight, we have a very interesting lineup of folks from representing different faiths and representing health. And I'm going to be introducing the first three speakers and followed by my co-moderator, Reverend Kimberly Ramlochan, who will introduce the second three speakers. The very first speaker will be Mary Evelyn Tucker, who is co-director of the Yale Forum on Religion and Ecology with John Grimm. She received her doctorate from Columbia University in Asian religions, specializing in Confucianism. Her concern for the growing environmental crisis led her to organize, with Grimm, a series of 10 conferences and 10 volumes on world religions and ecology at Harvard. They created the online course at Yale called Religions and Ecology, Restoring the Earth Community. So when I met Mary Evelyn, I felt I had met a kindred spirit, since this is something we've become in EarthMedic also very concerned about, how to restore the love of people for creation and all of creation. So without further ado, I introduce Mary Evelyn Tucker. Mary Evelyn, over to you.
Thank you so much, James, and thank you all the organizers and the co-speakers. It's really an honor to be with you because this is probably one of the most important conjunctions we can imagine, we can envision. And that's what this is today, I think, a beginning of how education, how research, how practical programs can be enhanced and developed over the next number of years. Let me just say, first, I want to respect and honor my sister-in-law, Sarah, who worked in Trinidad and Tobago in the 80s. And she was working through the Columbia Mailman School of Public Health and doing work especially focused on family and population and HIV education, developed a whole workbook for that for healthcare workers. So it's part of our family that the Caribbean is something we really care about. But I also want to say here, I'm thrilled with this interreligious dimension. And that means, as we know, I studied the religions of Asia, that the Asian religions are widespread all across the Caribbean, including Hinduism and Buddhism and Sikhism and so on. And as well, the indigenous traditions are there and throughout Latin America in very rich and robust forms. And definitely the Western religions of the Jewish and Christian and Islamic traditions, and Ramadan is being celebrated right now. So we honor that special time of fast. So, I want to just say that this is an amazing moment in certain ways that an interreligious webinar can take place. Because when I grew up, even in a Catholic social justice progressive environment, and the care for the poor and all of this was very, very important. But until Vatican II, there was no sense that there was actually truth in other religions. And we have come so far since Vatican II in the early 60s. And that means with all the religions. So I want to begin on a very positive note. Of course, there's many, many problems we know throughout the world with religions. We say there's problems and there's promise. And if we can thread that narrow link, so to speak, and say people around the world, 85% of the world's people have some form of religion that they identify. There's a billion and more Muslims, a billion and more Christians, a billion and more Hindus and Confucians. We need to draw in this moral force, this energy, this spiritual conviction for health. And that means, as James just said, health of people and the planet. This is the second conjunction that I want to highlight. So the first is interreligious understanding that's still emerging, imperfect, but a vast resource for us. And secondly, the resource that is quite astounding. I mean, I'm so thrilled that the Yale School of Public Health and, of course, the Columbia School of Public Health, and I graduated from Columbia, so this is a wonderful conjunction of these two universities. But public health is more and more aware of the issues of the environment, of climate change, of biodiversity loss, of pollution. These are the three big issues identified through the United Nations Environment Program. And that is relatively new. The notion of planetary health, of one health, of global health, that wasn't even on the horizon 15 years ago, I would say. So that is a new movement of understanding. So the third point is here, there's an allegiance between religion and health, because health is also understood now as holistic. This is body, mind. This is spirit, matter. I've just come from a acupuncture type of massage that helps get the chi flowing. This is what we need to do to be healthy participants in a world that is very much endangered, very, very critical moment. And on that note, I want to say, as a Northerner from the United States, I have a deep sense of apology and regret for what's happening here in our country, what's happened historically in Latin America and the Caribbean. We have to acknowledge the past and hopefully move towards a more robust present. And in that light, our teacher used to say, and here's the take-home line, I hope, that is, how can we have healthy people on a sick planet? How can we have healthy people on a sick planet? And we can go into this in all kinds of ways. The climate disasters, the rising seas, the pollution levels, the toxicities, et cetera, the cost financially of the hurricanes throughout the Caribbean are in the trillions of dollars now over the last several decades. The financial cost, the insurance cost, we're getting more and more aware of that. And the land cost, look what Maria did in Puerto Rico and so on. The notion that every single country in the Caribbean has been hit by this, from 88 Mitch, right, in Guatemala and Central America, 89 Hugo, $4 billion. From Harvey, Irma, and Maria across Puerto Rico and so on in 2017, 3 million people were displaced. So we've got the financial cost, we've got the land cost, and we have the people cost, the upheaval of climate refugees now. And again, trying to come north. We understand, we sympathize with these issues more than I can tell you. Many, many Americans sympathize with these issues because we are partly the cause of climate change, climate emergency, as it's now called. So what they want to underscore then is two maybe practical things. I want to underscore in my story that I'll share with you that this is going to take immense persistence, immense health for ourselves to keep it going against great odds, this conjunction of people and planet. It's a new idea. Some faith leaders will say, I don't know how to do that. Some health workers might say, well, I'm not sure we want the religious community involved, but they've already been involved, haven't they? They've helped, the religious communities have helped with disaster relief. They've helped with community centers for health care and so on. So this conjunction is already there. It needs to be lifted into a sense of this is now new and necessary, because there's no health on a sick planet. That's the overwhelming message. Now, there's so many things I want to say. We started those conferences at Harvard in the mid-90s against great odds 30 years ago. Academia is so square, they didn't get it. But with many, many people, we did persist. And this is why I'm saying, for you all, leadership, a sense of love, and a sense of luck. Leadership, you all have leadership. You have ideas. Your creativity is yearning to come forward. A sense of deep love for this planet. I think healthcare workers and teachers and religious leaders are some of the most generous giving people that we know. So that love, we have to keep feeding it. And we can feed it on the beauty of the natural world. The Caribbean is one of the most beautiful places on the planet. You know this way better than I. But the biodiversity, the winds, the waves that renew people, that's part of our spiritual renewal. And it gives health to people who are suffering. We know this now. Forest bathing, being in nature, what that does for healthcare. So let's think of it through that angle as well. So when we began this, there were no programs in religion and ecology, no field, but we had 1,000 people come to these conferences over time. We finished with conferences at the UN and so on. And there are now 30 graduate programs in religion and ecology across North America, including 3 PhD programs. And most importantly, because the younger generation wants this, they want this conjunction of meaning, of purpose, of giving. With the training that they're going to get at these colleges and universities. But they also, many are involved in the moral force regarding climate change. We have religious leaders who are being arrested in New York in front of banks that are investing in these fossil fuel industries and so on. So there's a huge movement within religious communities about fossil fuel and all kinds of issues regarding the environment. Let me just say, for example, Flint, Michigan, where water issues are huge, religious leaders are leading. Cancer Alley in Louisiana, where the air is so polluted by these oil refineries and so on. The notion that soil has been so contaminated. Environmental justice movements began with the religious communities up here in North America and in your own communities. And that was in the 80s when PCB soil was going to be put in the roads in Warren County in North Carolina, one of the poorest African-American counties in the US. And religious leaders and many women started this movement to absolutely stop that. And I could give you so many examples of this environmental justice movement that's coming forth in your communities, I'm sure, but much more clearly needs to be done. Now, let me just say, I could talk forever, as you know, and I think this is so important. And James and others have been such leaders here. Let me give you 2 examples of principle and practicality. of a field moving forward within academia and beyond, and a force that's making changes. So if we say after
Bomba.
Vatican II,
Misschien in het alfabet.
after Vatican II, there was a movement towards social justice. And that released, as you know, in Latin America, liberation theology. And liberation theology, through some of the greatest leaders in Peru, Gutierrez, in El Salvador, Sobrino, and Cardinal Romero, for example, that force of social justice, of care for the poor, is something that still endures, doesn't it, across Latin America, despite many, many problems. And that's true. It's true in Protestant communities as well as Catholic communities, that this tremendous sense of social justice is significant. And Paul Farmer is someone I want to hold up, who worked in Haiti, as you know, and he was very inspired by liberation theology and so on. And his work is an amazing example of what can be done when the religious force and the medical force come together. And so that's the larger change of thought that we again can build on, liberation theology, that's now in many forms around the world. But the other is these practical places that have been working on this for a long, long time. I want to highlight just one community in Nicaragua, and that is Jubilee House. And it's a community that foregrounds healthcare. They have a clinic, as well as education, as well as sustainable development and sustainable agriculture. And the reason I want to highlight it, it was began by religious people many years ago. But 25 years ago, I taught at Bucknell University in Pennsylvania, and one of our colleagues led what he called was a brigade of students and faculty and medical workers from the North to work with Jubilee House. And for 25 years, especially through the medical clinic there, they have helped with bringing doctors and nurses and so on. And in fact, this was the first time the health clinic was established 25 years ago. And it served 17,000 patients and 70 patients a day. Now, that is this conjunction that I'm talking about, which I'll conclude in just a moment so that everyone can speak as well. But we are finding new synergies, aren't we? New synergies that weren't imaginable. But our sense of our leadership, our love, and a sense of luck. Funders came on board for Paul Farmers, and funders are needed everywhere. But I do think, especially around the world, philanthropists are going to step into the breach of helping these kinds of new alliances when governments are pulling away and thinking that armaments and militarism is the way to go. No, we cannot cut back on the social programs, the health programs, the educational programs, and the advocacy of religious communities will be absolutely essential. So my hope is that this movement towards planetary health, this movement towards interreligious cooperation, which is still relatively new, which is tender, which is emerging, can begin to flourish. It's like we blow on this fire that is incipient. It's within us, it's without, and the earth itself will help us. Because fundamentally, the earth is the greatest healer that we have, with its air, its soil, its water, and its sense of a communion of subjects, of interrelationships. Thank you so much. So much more to be said, but I look forward to my co-speakers. Thank you so much.
Thank you very much, Mary Evelyn, and greetings to everyone who has joined from across the Caribbean and from Africa and from North America, and very much welcome to you. So Mary Evelyn told us, how can we have healthy people on a sick planet? And she told us about the hope that there lies in the conjunction of religions and the conjunction of faith and people of a health background. She also told us it's going to take a lot of persistence. This is a long journey. We didn't get here overnight, and it will take time to get out of it. So you can perhaps think of how else you would like to see us continue with this line of work. It is now my pleasure to introduce Riaz Shageer. And Brother Shageer is taking the time from Ramadan to come and be with us this evening. He is an accountant by training, a senior manager, and the lead software developer for PricewaterhouseCoopers in the Caribbean. So what's he doing here? Well, he's also an assistant imam in the Islamic faith at the Enterprise Community Masjid in Trinidad and South Trinidad. He serves as treasurer of the board of directors of the Islamic Home for Children in Gasparillo, which is in South Trinidad. He has a strong background in finance and in academic Islamic scholarship, with a master's and bachelor's degree in Islamic studies from the International Open University. And I've had a chat with him before. I'm looking forward to what he has to say, to tell us what does Islam say about all of this, and how do you mobilize Muslims? Thank you, Riaz.
Thank you very much. Thank you very much, James, for the introduction. Thank you to the organizers. And although I didn't plan to thank Mary Evelyn, it was very interesting, extremely interesting hearing what they had to say. My speech, we don't have that much time, so I'll try to touch on two main topics, right? Firstly, what does Islam say, if anything, about the environment? Or is it direct? Is it indirect? The second thing is, how do we then mobilize Muslims to act upon these things, right? Now, the first part of it, what does Islam say about it? We actually, as Muslims, we don't need to go further than the primary sources of Islam. The primary sources for Islamic knowledge is directly from the Quran or sayings of the Prophet himself. Secondary sources would include whatever we extrapolate from those primary sources, right? But these examples that I would give here is from the primary sources, meaning there is not much need for extrapolation and there's not much difference of opinion in what I say. These are agreed upon principles in Islam. So I'll give you just a few examples that I have. The first one, from the very beginning, the creation story of Islam, right? It is extremely similar to the creation story of any Abrahamic faith. God created the earth in 6 days, and then he created man within that time. In the creation of man, there was a point where God said to the rest of the beings that were alive he created before mankind, humans, I am going to create this being called man, and I'm going to put him, and this is in the Quran, inni ja'ilun fil ardi khalifa, I'm going to put him as a representative of me on earth. This is the creation story. The whole reason for the downfall of Satan, as we know him, was that he wanted that job, the job that we now have. And part of that job, part of God giving us that dominion, would then directly imply, not even through a few hops, that we are now trusted with this earth, for which we will be held accountable for, meaning in front of him directly on the day of judgment, right? So it starts off with the creation story. Secondly, Islam places an extreme importance on the idea of wasting anything, to the point where it is directly mentioned in the Quran. Allah says, do not waste, for Allah does not love those who waste. It is a direct command showing not only is it frowned upon, but it is what we call in Islam a disease of the heart to waste. How seriously do we take this? It's not something that's just there in the Quran and doctrine. It's something that is applied. I'll give you an example. 1500 years ago, this is in the time of the Prophet himself. Muslims, what we do before we pray, we actually wash, right? We wash, we clean ourselves. That cleanliness is such a high level that we call it the key to heaven. It is a key to heaven, that cleanliness. This man in the time of the Prophet, he was washing himself to pray. And while washing himself, the Prophet passed by him and said, don't waste water. And he was taken aback. I mean, don't waste water? You're telling me don't waste water, but I'm doing something for God. The Prophet replied, do not waste water even if you were at the banks of a river. The idea of wastage, arguably, I'm saying because I'm not the scientific expert here, right? But the idea of wastage, right, arguably could perhaps be tied, if we think about wastage of our resources, wastage of natural resources, personal resources, the things that we have at hand, arguably could be linked to perhaps any sort of environmental issues that we have. And Islam speaks about it directly. The other thing Islam speaks about is something we call ongoing good deeds. Is a concept that perhaps is unique to Islam. I don't know. We believe in order to get into heaven, we have to do good deeds. It's like a currency, if you want to think of it like that, right? The inherent limitation of a good deed is that you need to be alive in order to do a good deed. I can't do a good deed if I'm dead, right? It's obvious. It seems obvious. But Islam comes and the Prophet gave us some example. He says, listen, if you plant a tree, this is from the Prophet himself. If you plant a tree, any creation of God that now benefits from that tree, it will be counted as though you yourself did a good deed. So James plants a tree today. It's a nice mango tree. We're in the Caribbean, right? Nice mango tree. 1,000 years from now, a squirrel eats a mango from that tree. It is counted on James' good deeds as though he fed that squirrel. Right? This is something that's ongoing. Not only that, but if we were to say, well, okay, hang on, James' children has planted, he took the fruits of these trees and planted 50 more mango trees. Those 50 mango trees will be counted into this. It's like a compounding investment for the finance people, right? It's compounding until it goes later. Like it could blow up into massive good deeds then on your scale. A good example of how seriously Muslims take this. There is a well in Saudi. Most people don't know it. Many people who know about Islam, they know about the well of Zamzam. This is a different well. This well was procured by a man called Uthman, a man who was a companion of the Prophet like 1,500 years ago, right? When Uthman procured this well, I mean, to put it into context, if you have a well, right, in the middle of the desert, that is money in the bank, right? You will be a millionaire by tomorrow. This guy, Uthman, he decided, listen, I'm going to give it to charity. Ladies and gentlemen, 1,500 years later today, not only does the well still exist, but the well is now feeding a garden. The aerial footage of which I have seen is beyond where your eyes could see if you go a few feet off above the trees. The food from that garden is used to prepare millions, literally millions, perhaps even billions of meals every day. The government has taken it upon themselves to go as far as creating for Uthman a bank account that comes out of this. And out of it shows then the seriousness Muslims put in terms of building infrastructure to see about the environment. It is a commandment in the religion to not waste and to do these ongoing charities. There's many more I could say, but as time is short, I will end with the second part of this. How do we activate Muslims? See, Muslims are unique in a sense in that it is not that easy to activate Muslims via media, to put an ad out there. How you activate the Muslims is like this. We have what we call centers of knowledge, right? We have centers of knowledge in Saudi, we have Pakistan, we have South Africa, we have India, Deoband, these places. To come up to an Islamic solution of something is a process. The inputs of those processes change over time. For instance, 100 years ago, we thought that smoking was a good thing. So therefore, the output of that process is that, listen, Islam, since it's a good thing, is allowed. Now we know that it's cancerous, it could kill you. And because that science has changed, we now change the Islamic stance because the inputs to the Islamic system, a system called ijtihad, is now changed. To activate the Muslims, and this is my opinion now, away from the primary sources, we need to activate that scholarship because I can tell you from experience, once the science is presented to them and they make the decisions at that level in the various centers, It spreads through the Islamic world like wildfire. That's one. And when it comes to Islamic finance, the finance of the people, they are not ashamed of putting their time and their effort towards it. If it starts from there, because it gives them the validation that they need, right? I think I'm just over the time there. Thanks very much, guys, for the opportunity. James, I'll yield back for you, and Mary Evelyn, again, thanks very much for your contribution.
Thank you very much, Brother Riaz, for taking your time today and during Ramadan. You told us about humans as trusted representatives of God in your paradigm to take care of the earth. You told us about the importance of wastage, and I winced when you said that because in healthcare, we actually waste a lot. You see what an operating theater generates an enormous amount of waste. Now, some of that is for good reasons, but we could do a lot better. We could do a lot better. And you told us about how science and new knowledge can inform Muslims and how that can be used to activate Muslims in this cause. So thank you very much, and good luck to you with the rest of your day. It is now my pleasure to introduce our third speaker, Carolyn O'Brien, who is the co-director. Sorry, wrong script. Carolyn O'Brien leads the Christian Connection for International Health efforts on Christian health asset mapping and coordinates and supports their 30 by 30 health systems initiative. She monitors project activities on their grants and ensures overall implementation of all the grant activities. She served as Peace Corps volunteer in Albania, working on health education and female empowerment. She has global health research experience in household air pollution and in road safety, two things that are important causes of suffering and death. She has a master's from Johns Hopkins Bloomberg School of Public Health and a BA from Calvin University. And Carolyn's going to be talking to us about Uniting for Health, a faith-driven response to climate change in low and middle income countries. Carolyn?
Thank you, James. Let me just share my screen. All right. I think we should be all set. So welcome again, everyone, and thank you, Dr. Mary Evelyn, for the inspiring start of all of this, and Brother Riaz as well. As James said, I'm Carolyn O'Brien, Program Manager at Christian Connections for International Health, or CCIH. If you're not familiar with CCIH, we're a global network of over 100 Christian organizations, as well as secular and interfaith partners committed to advancing health and wholeness. CCIH members work in over 90 countries globally. These members include non-governmental organizations, church networks, Christian health associations, volunteer and product donation agencies, and many other support organizations. So my presentation today is really going to focus on how to partner with faith-based organizations. What are the unique features they bring to climate change conversations, and how can we work together to adapt to increasing climate crisis? So a little bit of background about the initiative that CCIH launched last year. We are calling it the Faith Consortium for Climate Resilient Health, or Faith for CRH. So that's how I'll talk about it for the rest of this presentation. We started in 2022, CCIH, talking to our members about what programmatic and operational effects are they seeing because of climate change? How are they being affected? What role are they wanting to play? What programs might they already have? What questions or what support could CCIH offer? And across the board, we heard, yes, climate is affecting our programs and operations in various ways. Some of our members had climate-related projects or projects that touched on some climate aspects, but many, vastly the majority, said this message of We know climate's affecting us. We know it will continue to affect us even more, but we don't know where to start. It's a huge issue. It's affecting every part of our organization. And so what steps do we take to even start to address the effect that climate has? And so we pulled together with a few partners to start forming our consortium and identifying what goals we could have in supporting faith-based organizations in low and middle income countries adapt to climate crisis. We launched the Faith Consortium for Climate Resilient Health last year in June of 2024, with the goal of increasing resilience for not only CCIH members, but faith partners across the globe. And now here we are in 2025, creating this movement of faith-based partners to address and adapt to climate. So here is just an overview of our mission and vision. We are, like I said, wanting to increase climate resilience with faith-based health partners. Those health partners span a variety of roles, and I'll get into that a little bit later in my presentation. But we, and CCIH in general, this is a major role we play, is elevating voices, sharing stories, partnering with organizations that may not be familiar with the work of faith-based partners of religious leaders and the important role that they play in community, and raising those stories and voices to high places so that people hear the important work of the faith community. Our vision, there's 3 aspects of that. One is that communities have consistent access to quality healthcare. They are prepared for the impacts of climate change and have the tools they need to adapt. Here are the 7 current members of Faith for CRH Consortium. Some of these members are one country based, registered, and focused, and other partners you'll recognize have offices and operations in several different countries, but this spans many different regions, including Latin America and Caribbean. I won't spend much time on this slide because you all know probably better than I do the effects that climate has on health. And we've heard even in the beginning of this session of how climate change and the climate crisis is increasing in health effects. I will spend some time here because at the beginning, Dr. Mary Evelyn so eloquently highlighted the links between religion and environment. And then we heard from Brother Riaz about what Islam says about the environment. And because this is a Christian initiative, just highlighting a couple of background or supporting reasons why the Christian community and churches should support and work towards addressing climate is the work for environmental justice is a biblical principle, living in harmony with nature, and responding to climate change is also an example of restorative justice. I will put a link to this in the chat, but at the launch of the Faith for CRH Consortium, we launched this action statement, and this provides some of the background I've already given, but there's a lot more about the Christian background of supporting environment and addressing climate crisis, as well as what our goals are, what movement we're hoping to initiate and catalyze, and then what those objectives are for this consortium moving forward. All right, now it's time to really dig into who are faith-based organizations, what do they do, and what role should they be playing, how to partner with them in upcoming climate crisis. So faith-based organizations could be direct service providers, support services, and they offer trainings and other programs. There's a wide variety of what faith-based organizations do, but I really want to focus on the link between religious institutions and health institutions. Faith-based organizations offer a great link and an important link that becomes even more critical during emergencies. So faith-based organizations are often local and respond at the local level. They have historic ties that leads to trust, being a very important aspect of what faith-based organizations are able to do and accomplish in the community. They are part of a varied health service landscape, so that can be hospitals or health centers, to even more informal health providers like community programs, drug supply organizations, research institutions. There's a wide variety of health assets, faith health assets. And then they're well networked in their own communities, countries, at the country level and the global level oftentimes. Some of the major challenges that FBOs face are exclusion from local, regional, and national health sector and emergency planning, resource allocation, emergency management discussions. Oftentimes, there aren't faith representatives at those important planning conversations. And then once a disaster hits, or a pandemic, something like COVID, then people are kind of in a panic. Okay, how do we reach the private sector? Who's there? What leaders can we trust to deliver these messages and to help us implement these emergency programs? And those problems could be avoided by having important religious leaders and representatives of faith-based organizations at the table, at planning, at national, regional, and local levels. Oftentimes, there is a constrained bandwidth for participation, though, because there's such a wide variety of things that FBOs are trying to do, especially religious leaders. They have so many responsibilities as well. It can constrain resources and time. Are FBOs interested in climate change? What we've heard is yes. Yes, they are. But sometimes we're not using the same language. Oftentimes, even we heard in our landscape analysis, some of the FBOs responded, no, we're not really doing anything with climate. But when we talked further, they were doing some restorative conservation activities or other types of emergency preparedness that all had some tie to climate. So sometimes it's just about the language we're using. For the most part, FBOs are responding to climate because they have to. It's happening, and emergencies are becoming more extreme and more frequent. But FBOs, as I mentioned before, they're daunted by the lack of resources, exclusion from decision-making, sometimes inappropriate tools. There are some great climate planning tools, but oftentimes they're tailored to high-income countries and different and not inappropriate language or context. Here are our two main goals for the consortium. The first is to really try to mobilize resources and attract funding for FBOs to develop tools that are context specific, that can be adaptable to the communities that they serve. So here on the screen is a list of the types of tools we've heard that would make a big difference in climate crisis scenarios. The second goal is to create a small grant program that would provide funding for early experimental type projects, implementation of promising practices that already exist, or acquiring assets, infrastructure improvements. We know those are so important to preparing for climate crisis, but oftentimes are the most difficult projects to get funded. Here is an adaptation framework that we developed. It is pretty general for responding to a specific hazard. So I'm not going to spend so much time on this framework, but I'll spend some time on how it can be applied in the next slide. So we know that in the Caribbean, there are lots of floods that happen due to hurricanes and other scenarios, heavy rainfall. And so this is how we can apply that framework to flooding, specifically how to include the faith community and FBOs when there is some sort of a flooding event. So in each of these four areas, I'll just highlight one specific bullet that has to do with the faith community. So for example, this first box about education, this health facility climate adaptation checklist, that sounds general. Every health facility should have an emergency preparedness checklist or something to look at when disaster strikes. However, we are looking at building something that includes and is more tailored to the faith community. So for example, there could be a section of that checklist that focuses on what are the communication channels to the religious institutions? Who is the point of communication at the local church, at the local mosque, at the local temple? Which of these institutions is responsible for shelter? Which one is responsible for food? As Dr. Mary Evelyn highlighted in her talk at the beginning, oftentimes religious institutions are first responders. They've been first responders for a while, but sometimes the links in communication and integration and disaster planning isn't there. So Faith for CRH is really focused on that linking component, making sure folks are talking to each other. There's a link between health institutions and religious institutions, and there's a smooth execution of adaptation and emergency response. In the next advocacy box here, we see religious leaders engaging and educating congregations. So that could be helping to create sermon guides or toolkits for religious leaders to help communicate with their congregations or their communities on why is climate important, why we need to be focusing on preparing for disasters and emergencies, and comforting people who are anxious about what's to come and going through the disaster itself. Coping capacities in the bottom left, we've seen in other contexts, particularly in India comes to mind, religious institutions can help with water safety and swimming lessons, something very basic, but oftentimes in flooding, drowning is the #1 leader of death. And so something like preventative swimming lessons can come in very handy there. And then implementing structural mitigation, there's a huge list of things that can be done, but making sure that if religious institutions are the first responders or are providing shelter, that those infrastructures are taken care of as well. All right, as I close out, I know that was a lot of information. I just want to highlight a few key things. First, Faith for CRH, our main goal is providing a united voice on climate change within the faith-based sector. Why should FBOs be involved? How to partner? You'll see the rest of these bullets are focused on the partnerships. We don't want to be working in silos. Okay, the faith sector is doing this when emergency happens, and the public sector is doing this, and then other actors in the private sector are doing this. We need to focus on all of the different partners and how we can work together. And that's what Faith for CRH wants to see done. Thank you so much for joining in these efforts, for elevating this important topic for this webinar today. I'll put in the chat, we have a Google group where we share some updates about the Faith for CRH initiative, as well as some resources and things related to environment and Christianity. So I'll pop those in there and happy to answer questions at the end. Thank you so much.
Thank you very much, Carolyn, for giving us some of the background on what Christian Connections for International Health are working on, and specifically your Faith for CRH, Faith for Climate Resilient Health. You told us a lot, including one of the problems we really suffer with, the flooding, and the flip to that is the drought, when the crops get lost, both from the floods or the drought. And you told us about the need to join silos, to work together I would say, in the care of all of creation, both the environment and people. In the Caribbean, the faith-based organizations, churches are integral to the disaster response in many countries, oftentimes physically serving as disaster and hurricane shelters. And of course, they're dealing with a lot of the mental health impact and the suffering as a result of some of the climate events that we face. I am now going to pass the moderation to Reverend Kimberly Ramlochan, who is a lawyer and a person of faith, and she's going to take over to introduce the speakers after Carolyn. Kimberly.
Good evening, everyone. Greetings to everyone joining with us today. As we move along our panel, I am so pleased to introduce our next speaker. She is a minister of the Reformed Church in Suriname, and she is currently the chair of CANACOM, Reverend Diana de Graven. She was elected to chair in 2023. She studied theology at the United Theological College of the West Indies, and she obtained her bachelor and master's in theology at the University of the West Indies, Mona campus. And it's so wonderful to note that on October 22nd, 1995, she made history in Suriname as she is the first Surinamese female to be ordained to the Ministry of Word and Sacrament in the Reformed Church of Suriname, which is the denomination she belongs to. Her two areas of ministry is contextual theology and pastoral psychology. She is a people person and likes to lend a helping hand wherever and whenever is possible. She was a member of Quota International Suriname, a service group of professional women that assist underprivileged persons, the elderly, children, and hearing impaired. In 2010, she became a licensed English teacher and has taught English at the Moravian Theological Seminary in Suriname. This evening, I'm pleased to welcome you, Dr. Graven, to speak at this time.
Thank you so much for that introduction. I hope everybody can hear me well. And thank you so much, my previous speakers, for everything you shared so far, especially Caroline. Thank you for what you just shared with us. I am currently the chair of CANACOM, and CANACOM stands for the Caribbean and North America Council for Mission. We comprise of 12 denominations situated in, I think, 9 countries spanning North America and the Caribbean. And we are together exploring the endless possibilities of mission relationships. And we are totally committed to mission, to education, and transformational leadership within the region. We are a nonprofit organization, but our primary goal is to help one another. I had prepared so much, but so much has been said already. And I want to share our mission priorities. We have 4 mission priorities: church growth and renewal, gender and violence, poverty and inequality, and human trafficking. With poverty and inequality, we added in 2023 the whole idea of migration, people migrating within the Caribbean, within this earth, to different places, healthier places, places that are safer, and places where people can find a living to have it better than where they are. And we decided to focus on gender and violence and poverty and inequality. Within our organization as CANACOM, over spanning 12 denominations, most reformed from the onset in all these different countries, we try to work together. We try to assist where possible in our mission work, and when the need is there, to address issues when they are placed on the table before us. As mission agency, as a mission organization, as churches, because we are all Christian-based churches, as churches, our mission is to take care of what God has put in our hands. And what has God placed in our hands is the earth, to take care of the earth, as is said in Genesis, and as our esteemed speaker Riaz shared, we people of the Abrahamic faith, we share this whole notion of creation. God created heaven and earth, and he placed it in our hands to take good care of it and to make sure that everybody has a place, a good place on this earth. And when we last spoke, Mary Evelyn and James and myself and Daniele, Mary Evelyn said something and she shared it again this evening. How can we have healthy people living on a sick earth? And I said, no, we should not strive to have healthy people living on a sick earth. We should strive to have healthy people living on a healthy earth, on a beautiful earth, as the earth is meant to be by our Creator. And it all goes back to Genesis. When God created everything, he said, it is good. And when he created man, he said, it's very good. And this is repeated 6 times. It is good. God was content with what he created. But what have we done as humans to this creation of God, which he has placed in our hands? We are squandering it. We are destroying it. It's very unhealthy. And we have to look at our mission as churches, as faith-based organization, to maybe look back at it and try to find out, where have we gone astray? What is it that we are not doing that God has asked us to do? Is it that we have become complacent? Or is it that we think, oh, we are there already, we are the masters, because it was placed in our hands, and now we can do with the earth what we want? And most times what we want is not always the best. And in the Genesis story, we hear, or we can read about this word tov, the Hebrew word tov. Tov refers to joy, to relationship, but tov also means beauty. And when God created this earth of ours, it was beautiful. And might we say it's still beautiful, but our eyes are not seeing what is to be seen. What does it mean when we read that God sees that all that is created is good, is tov? With every creature that God created, an initiation is made of relationship, of love and beauty. And the earth as we have it, the earth as it is, we have to look at the earth as God's child, cherished by God. And we have to take care of that child. We have to make it healthy again as churches, as faith-based organizations. So much is said, and I liked the idea that Carolyn just shared with us, how we as churches, as Christians, can go about in achieving this. Within our theological seminaries, where we train people to become ministers, leaders in the church, within the faith community, we can look at theology and ecology. Maybe we should come up with a theology of ecology, I don't know, to make people aware that it's in our hand. But before we go to that theological stage as in seminary, we have to start at home. It starts at home, to within the family, to take care of the environment, to take care of where you live, to take care of the people around you, to make sure that everything is neat, clean, healthy, safe, secure. Later this year in April, we will have some youngsters from Trinidad coming to Suriname to work with a children's home, Roman Catholic children's home, to set up a hydroponics project, to teach the children to plant their own vegetables on a green scale. So no pesticides are being used and all of that to disrupt the environment, but with water, healthy water, to teach them to take care of their own, to make sure that they have enough to share with others. We in Suriname, we work with in the interreligious faith, but as CANACOM, we also are in touch with people of different faiths and how we can work together, not only as churches, but to reach out and to work together. How can we as CANACOM strive within our member churches to make people more and more aware of the impact the climate has on people's health? And when your health is affected, it also affects your faith. Most times you see people start going to church when they are ill, or they ask for prayer when things don't go well. But not only when it doesn't go well, we should pray and have faith in everything that is around us, and go to God with all the needs we have. So within the family, within the theological schools, within the Sunday school, within the church, set up Bible studies, create Bible studies where we, from the Bible, because the Bible is rich in resources, from the Bible, teach people how to take care of climate, how to take care of the earth that was bestowed to us, given to us by God, to have a healthy earth. So once again, Mary Evelyn, we should strive to go have healthy people living on a healthy earth and not a sick earth. We know that the earth is sick. We have to make it healthy again. And that I think that as CANACOM, we will strive more and more to make sure that within our member churches, this is brought, is advocated to the people, shared with the people. So in their programming, in their setting out their mission work, climate and health is also a part of the agenda of their work that they are doing. I would like to thank James in particular for inviting us as CANACOM to be part of this webinar, and we will see what the future holds for us, that as CANACOM working together with EarthMedic and EarthNurse to within the Caribbean to go from health professionals working with faith-based organizations. So we look forward as CANACOM to see what can come out of it. Thank you.
Thank you so much, Reverend Diana. We appreciate you sharing your knowledge and experience with us and telling us about the mission priorities of CANACOM, the mission to take care of what God placed in our hands, which is the earth. As we move along, our next panel presenter is Mr. Herman Jintie. He is a distinguished healthcare professional with extensive experience in nursing, public administration, mental health, and indigenous and tribal community development. He holds a Master of Science in Mental Health Policy and Services. He has dedicated his career to strengthening healthcare systems in Suriname. He has a diverse background, including diplomas in nursing and health management, a Bachelor of Science in Public Administration, and multiple certifications in health and leadership. He is the director of the Medische Zending Primary Healthcare Suriname, which oversees the delivery of primary healthcare services across the country's hinterland. With a career rooted in service and leadership, Mr. Jintie continues to be a driving force in healthcare development and capacity building across the region. To invite you now at this time, sir, to speak.
Thank you. Thank you very much, Kimberly, for inviting me to this wonderful platform and also to this network of persons in faith. Thank you very much. I am trying to share my screen. Let's see. Yes, it's okay. Can you see my screen?
Yes, yes.
Okay. Thank you once again. I've been asked to speak on this theme called Building a Climate Resilient Healthcare System in the Hinterlands of Suriname, spending some time to talk about the challenges and the opportunities. And indeed, it is a privilege as the director of the medical mission, which stands for the Medische Zending. It's the medical mission. So I'll use that term for this presentation, the Medical Mission Primary Healthcare Suriname. We as a religious-based organization, we're called and we are appointed by the Ministry of Health to guarantee primary healthcare in the hinterland of Suriname. It's as I said, it's a religious-based organization. And I'll try to elaborate on that a little bit and then talk about the work that we're doing, trusting that this will be like an example of how a Christian, a faith-based organization is trying to bring healthcare. And because of the fact that the hinterland of Suriname is also call it a victim, but is suffering from climate change. So hopefully this can add to your information this afternoon. As I said, I'll talk a little bit about the Medical Mission Primary Healthcare Suriname, and we developed a model of care, and I spent some time on that model of care, and then talk about the challenges and the opportunities, and some slides on the impact of climate change on our work here in Suriname. The Medical Mission Primary Healthcare Suriname is working in the interior, in the hinterlands of Suriname, and we're working actually with two main target groups. Those groups are the indigenous on your left, in the PowerPoint slide, and the tribal population on the left. No, on the left, the indigenous, and on the right, the tribal population. And the indigenous population consists of almost 7 tribes, as well as the maroon population, the tribal population, 7 tribes, 6 to 7 tribes. So this is the map of Suriname. And actually, the light green part of the map is our catchment area, our surface area. We're covering almost 90% of the total area of Suriname. And we have clinics all over the place where people are living. And we're responsible, as I said, for primary health care in the hinterland of Suriname. This is a very challenging operation because of the remoteness of the area. Most of the villages the green dots, these are all clinics in our catchment area, and some of them are reachable by car, some are reachable by boat, and some almost in the south, they only can be reached by aircraft. Okay, so the medical mission, we have a coordination center in the city. In Paramaribo, we have divided our region in 6 regions. As I said, we have 58 health clinics, 13 general practitioners, doctors, and we have 125 healthcare assistants. These are trained professionals, and I'll elaborate on that within a while. We have supporting staff, and our target group is approximately 50,000. We call them the stable population. These are population that are living within the villages and the camps. While we have almost 20,000 mobile population, these are persons from different nationalities, and they work mainly in gold mining and forestry, but also people that are passing through government official, etc., they're making use of our service also. So the Medical Mission is a faith-based organization providing basic healthcare in the interior of Suriname, and it's based on primary healthcare principles. The Medical Mission healthcare system is focused on curative care, preventive care, and we're also promoting well-being of communities. As I said, 58 clinics, and we're working with healthcare assistants. They receive a training from the Medical Mission, and they work together with other professionals. This healthcare that we're providing is offered decentralized, and we are coordinating it from the main city, Paramaribo. As I said, we have a basic service of the Medical Mission, consists of first aid, family planning, mother and child care, school health program, preventive program. We do research and treatment of communicable diseases as well as non-communicable diseases. And we do dental care. We do have some supporting services. Outreach, we do a lot of outreach. These are pictures of people, of our healthcare providers in villages. So we're not staying a lot in our own premises. We are doing a lot of outreach. We're doing laboratory service also because we're the only healthcare provider in the interior. We don't have labs and pharmacies. So all of our clinic is a small laboratory. We are making use of rapid tests. We do telehealth also because of the remoteness of the area. We have a health information, health management information system. Actually, we admit patients in our premises also when it's needed. We have second line care. We are bringing in specialists and seeing patients. We have a data collecting department that use data from all these 58 clinics so we can make policy in time to respond to health threats in the different regions. And as I said, every clinic is a small pharmacy because we are the only one. So when we prescribe the medication, we will also give it to those who are in need. I said I'll spend some time talking about the healthcare assistants. These are professionals, health professionals. They're the first to consult when you come to a clinic. They can operate independently, supported by doctors, medical specialists, microscopists, lab assistants, and other supporting staff. They're being trained for 4 years by our organization, and they're under the supervision of the Ministry of Health. They work with protocols and know when to consult a doctor. They are the ears, eyes, and hands of the doctor, and they know the culture, the language, and the way of life of this population, which is very difficult for Western trained doctors. And they are from the region. So we recruit them from the region, train them, and send them back to the region. This is a picture of one of our healthcare assistants in a remote village called Kwamala Samutu. So winding down to climate change and the impact of climate change in our organization and our catchment area. This is a bridge leading to a clinic, and because of climate change, the flooding has washed away our we call it a bridge. It's like the landing space of the boats when patients have to come to the clinic or healthcare workers have to go to the villages. And this is another picture from the impact of climate change on our work. And actually, because of the remoteness of the area, most of the time during drought or during flooding, we have to make use of aircraft to drop things in the interior or to move personnel within our catchment area. Beside that, because of the remoteness of the area and the excessive rain or drought, we most of the time we have to use these aircraft and this is a very expensive operation because for instance, charter one of these aircraft to one of our remote village costs almost $3,000 or $4,000 US. I want to spend a few minutes to talk about the challenges. Addressing climate-related health challenges requires a multi-sectoral approach involving energy, water, and urban planning. We're working closely together with all sectors within the interior, because if we want to address the challenges that we're facing, we need this collaboration with different organizations. And the need for technical capacity building and a thorough assessment of our health systems and facilities to ensure they are capable of withstanding the effect of climate change, such as rising water levels, temperatures, and water supply fluctuations. The importance of strong leadership with a call of a commitment to adaptation planning from the highest level of government and minimal political interference. These are some of the challenges that we're facing. But there are also opportunities. The Pan American Health Organization, for instance, is planning to provide us technical support for vulnerability and adaptation assessments, which will be conducted later this year. They're also helping us in shaping of a comprehensive health national adaptation plan tailored to Suriname's unique needs. Health facilities will also be evaluated in this year to develop smart facilities, those that are resilient to climate change and other shocks. Climate resilient water safety plans are also set to be developed and implemented, and early warning system for heat waves and vector-borne disease will be established in the coming years. So what kind of impact does this have on our organization and the work that we're doing? Because of the climate change, we're seeing an increase of waterborne disease in dry and rainy season. And as a health professional, or those who are aware of the impact of drought and flooding on the health of populations, we know that most of the time when there's a drought, people will have a lack of fresh drinking water. They will use other kind of water, and you can have waterborne diseases. As well as when there's a lot of water, all kind of things will be in the water. Beside that, because of the lack of containers to have fresh rainwater, people can have waterborne diseases also during flooding. Secondly, because of the drought or the flooding, we have to spend enough time to educate our communities on the importance of clean and safe drinking water. This is a picture of healthcare workers that are busy with children during a WASH program, where they teach them how to wash their hands and how to use fresh drinking water in a time of extreme drought in our communities. And because of the drought or the flooding, we have to supply sufficient drinking water. Last year and even this year, we supply our own personnel because there was a very big drought in our catchment area, and even our healthcare workers had not enough water. So we supply them with water and food, especially in the dry months last year. And because of on the left up, you see our healthcare workers in a boat during flooding. The villages were really flooding, and they had to do home visit, and they had to work from out a boat to give health education, but also help those who were in need. And on the bottom of the slide, you see the drought, the impact of the drought in one of our rivers, the Boven Suriname river, where we couldn't even move our own personnel. People have to help themselves draw the boat to pass through the waterfalls. And on the picture on the right, this is the flooding. And these are clinics of the medical mission. They were all flooding because of the high water in our catchment area. To summarize, climate change is here to stay, but also healthcare will stay. So we have to look at ways how we can help each other and assist in helping our communities. And I'm very thankful for this opportunity because even during the previous speakers, I see that there are a lot of opportunities and networking that we can do to help our communities in dealing with the impact of climate change on health of our communities. Thank you very much.
Thank you very much, Mr. Jintie, for that very insightful presentation, especially to learn about the work that is being done with the indigenous and tribal people. You actually helped us, to see exactly how climate has been challenging and impacting the people in Suriname. And we appreciate so much. So we can actually see how we could actually get involved as faith-based organizations and make a difference. So we thank you once again. Our final presenter this evening is Miss Tiffany Ali, and she would be speaking from the perspective of the Hindu faith as it relates to the responsibility to care for all creation. Miss Tiffany Ali was admitted to Trinidad and Tobago Bar in 2016. She's a dedicated attorney specializing in both criminal and civil law. Beyond her legal career, she is deeply committed to community service, serving as chairman of Project U, a nationally recognized nonprofit organization dedicated to supporting vulnerable communities. She is also a national youth mentor under the Ministry of Youth Development and National Service 40 Under 40 program. And in addition to her legal and mentorship roles, Tiffany has made history in Trinidad and Tobago's cultural landscape. She was the first female to portray the avatar of Lord Shiva in the first Felicity Ramlila and cultural group's 100th Ramlila, a role she has proudly reprised multiple times. Her contributions span law, leadership, cultural, and religious preservation, making her a trailblazer in both her profession and her community. So we welcome you at this time, Tiffany, to give your presentation.
Thank you so much, Kimberly. Let me begin by saying good evening and hello to everybody on the panel and to everyone who's in attendance. Thank you so much for giving me this opportunity to be a part of such an important and impactful conversation that unites us all in spirituality, ethics, and protecting the earth we live on. It was so important. I have to improvise here just to tell you all that I have been awake since 1 a.m. I'm in India right now. And this conversation was so important to me that I needed to really show up and be a part of it. I'd want to give a disclaimer though, and humbly ask forgiveness from the wider Hindu community if in my contributions today I say anything that might be incorrect or contradictory to your central tenets of the Hindu faith. I'm not a pundit. I don't have a PhD in Hinduism. I'm only a lifelong practitioner and a seeker of spiritual living. I might not be a minister of Hinduism, but I consider myself for my entire life to be an advocate of Hinduism. So I only hope to bring that perspective to the discussion today. So an important question to ask in order to address the topic that was raised today is, what is Hinduism? I have been asking this question since I was 11 years old when I adopted the practice of Hinduism. And I asked this question up to maybe 5 minutes before it was my turn to speak to ensure that I am representing the philosophies and beliefs of this religion to the best of my ability today. For context, I have learned about Hinduism through various sources, through attending Hindu schools, by participating in community activities, through oral traditions from my older generations who would have shared their beliefs and knowledge of Hinduism, by attending congregation services in temples across or mandirs across Trinidad and Tobago, Guyana, and India. I have started teaching myself Hindu scripture through their textbooks, the Vedas, the Bhagavad Gita, the Ramayana, and now I'm reading the Mahabharata. And I've even taken it so far where I am studying Hinduism through what I've now seen as a new development in the podcast arena for spiritual podcasts and documentaries on this faith. I have discovered that Hinduism is as diverse as the estimated 1.2 billion people who practice it around the world. And Hinduism is not an organized religion, and it has never tried to be. It is a word that describes a group or multiple groups of believers who share some things in common and also have variations and differences in their beliefs. But despite that, the differences and variations, the one thing we have in common as Hindus around the world that I have found is that it provides a definition and a way of life for all its believers. It comprises complete guides to living, including how you work, how you perform your work, your family life, your physical health, your diet, your mental well-being, and most importantly, the world at large, your relationship with the world at large. I could only speak about Hinduism from what I have learned at home in Trinidad and what I have learned now in my own travels and experiences. Hinduism recognizes this concept of Brahman, which is a supreme entity from which everything originates. And when I say everything, I mean everything. All of the elements on earth, the air we breathe, the water we drink, the rivers, the mountains, the birds, and the bees. Hinduism presents or represents God as a reflection of God's inseparable nature from all of God's creation. It generally posits that God is within and external to all of creation, and that necessarily includes, as I said, the environment. Hinduism also has one common and predominant principle, which is nonviolence or ahimsa. Most people would have heard about this from, the late Mahatma Gandhi, right? Nonviolence here is a clue to the commandment on Hindus to protect and preserve life as we know it, creation and living things, and it promotes the symbiotic coexistence between man and nature. For me personally, I feel very strongly about this aspect of Hinduism. The very core of this faith calls upon me as a Hindu and all Hindus to recognize godliness in everything in the world around us and treat it with veneration. In one of the many ways a Hindu could pray and worship God, it's through pujas or prayer rituals. And puja itself is a systematic set of rituals where we acknowledge the existence of all celestial bodies, the planets, rivers, cotton, food, grains, everything that we were given naturally by God on this earth to survive. And this very act of praying is designed to identify, recognize, and give gratitude for all that we have naturally occurring on earth. Other examples of Hindu practices that recognize and honor the unity between a Hindu and the world we live in is Hindu funerals. Hindu funeral rituals by itself is a testament to the belief that we are all part and parcel of the larger creation. And in the end, a Hindu is returned to the elements that form part of cosmic life. It's also important to acknowledge the contribution of Hinduism to the medicinal world through Ayurveda. Historically, Ayurveda has promoted organic, sustainable medicinal practices for healing and healthy living. And today we can observe around the world that Ayurvedic practices are making a comeback or becoming quite popular again. It's also worthy to mention here that Hinduism permits us to feel comfortable personifying God, nature, and the world at large, especially if it helps us to adopt a humane and conscious approach to how we deal with living things. It enables us to recognize that God is present in the sun, the moon, the rivers, and the seas. God is embodied in the birds and the trees. And God is within us, around us, and in everything we could see. At least that's what me as a Hindu is taught to believe. Naturally, then, I feel duty bound to preserve Earth and to protect Earth. And Earth is likened in Hinduism to a mother. Most Hindus are taught, if not all, that rivers and water bodies are goddesses themselves. Most, if not all, naturally occurring elements of life in Hinduism are likened to some celestial existence. And so it impels or imposes upon us the desire to treat it with the respect that we would give in God and faith and prayer. So how then could Hindu philosophy positively impact climate change? In this century, I have recognized, as we all would have in our respective fields, the exponential growth of the human race and by itself, the exponential consumption of people in their daily lives. Religious activities, which once called for using natural items, for example, ghee, oil, clay utensils, have now been largely replaced with synthetic materials to meet the demands of the growing population that practice this faith and ritually participate in religious ceremonies. There is a glaring difference today between the idealism of the faith and the reality of its practitioners. If Hinduism was practiced today in its purest form, we may see a world where food is harvested sustainably, waterways regarded as divine are kept clean, free from pollution, animal life would be treated with highest regard, and natural resources would not be exploited, giving human life a very high quality. But that isn't often the reality of today. I suspect that sometimes as humans, our personal desires for comfort often outweighs our considerations for the world at large. And even though we may be believers of a particular faith, sometimes it's very easy to put that on the back burner when making your day-to-day decisions. That leads to a dereliction of your duty and the way you practice your faith. I don't know if it's because of cultural reasons or consumerism that has prevailed today, but most people I find are abandoning the simplicity of the organic nature of our religious practices in favor of something that is more beautiful, commercially recognized, but unsustainable and dangerous. As the chairman of a nonprofit organization in Trinidad and Tobago, I'm often guided by Hindu philosophies to determine my response and the organization's response to our social outreach. We prioritize sustainable products when we give products in some of our menstrual health campaigns. We work with companies who prioritize natural products and sustainably harvested products to do so. We support community education and advocate for human dignity across all areas of life. As Hindus in general, we can abide by some simple rules for developing and maintaining harmonious and environmentally sustainable lifestyles. By practicing your Dharma as proposed by Hinduism, you will naturally recognize the universal interconnectedness of religion, ecology, ethics, and science. By being mindful of your karma, because you will be mindful that all actions and inactions have reactions and consequences. You'll treat Earth as you would your mother, because we treat Earth like a mother. You would respect Earth, you would nourish Earth, and in turn, Earth will nourish you. You will develop a level of veneration for the elements of Earth, because you will never be able to forget as a Hindu that you depend entirely upon it to live. It's also important to remember from the context of scripture that these things are sins. It's considered a sin, and there are religious injunctions found in all of our texts against the desecration of creation. Scripture says that the entire universe and everything in it, animate and inanimate, is part and parcel of the divine. It is for us to enjoy without excessive use and without exploitation. So on behalf of the Hindu community and to everybody that is here today, I can call you to action to, practice certain things that could benefit the community and the world and positively impact on climate change by reducing your use of non-biodegradable products in your religious practices, by taking personal responsibility for waterways after using it in religious ceremonies to avoid long-term pollution. Practice sustainable farming and agriculture by being mindful as well of unsustainable consumptions, whether that is in the way you travel, your gas consumption, electricity, even your food habits. Recycle, there's nothing wrong with reusing things, and reverting to the sustainable ways that Hinduism has always proposed, even though it may feel a bit inconvenient in modern times where we love instant gratification. So I don't want to take too much time. And in conclusion, to my contribution, I want to highlight again that the ecosystem of Hinduism and Hindu beliefs in and of itself calls upon us to take personal responsibility for the world around us. It reminds us that we are human beings, but as human beings, we have no dominion over creatures, and we are ethically forbidden from exploiting nature. As Hindus, we're called upon in our everyday lives, at every stage of our life, to self-reflect in our spiritual progress with an aim of becoming and living harmoniously with the universe. And by instilling these essential beliefs from our scriptures and our culture around the world, the Hindu believer can and should become a guardian of Earth, making conscientious decisions in our everyday lives to protect what God has given us, not just for the sake of religion, but for respecting ourselves and the future generations who will also come forward to rely on the earth and to live healthy and safe lives. Thank you, everybody.
Thank you so much, Ms. Ali, for such a valuable presentation. You have truly given helpful insight into your faith perspective on the environment and climate care, and we truly appreciate all that you have shared and how integral care for life and for the world is to the Hindu religion. So we thank you so much again. I know we have a short space of time now for some questions, so I'll hand you back to James so he can take over from here.
Thank you very much, Kimberly, and thank you to all the presenters. I've sat here enthralled this evening. We've a bit over our normal time. I had a sort of pre-question, what do we see in common across faiths? And every presenter has told us that there is a lot in common, certainly for the caring for the environment and the planet on which we live, and that surpasses a lot of the differences that we often harp on. There are questions for, and we're just about out of time. There are questions for several folks. One question I have, and please just put it into the chat, is what would you like to see next in this conjunction of faith and health? If something was stirred in you, if you have an idea, just pop it in there. What can we do next? A practical question, I think, which any speaker could address is, how could individuals, whether in faith community or healthcare field, take that first step towards collaboration in their own local context? And I'll just pause. If there is this commonality, how do we take that first step, whether you're from a faith background or from a health background? And I wonder if we could have a couple of quick answers to that. Nobody's got a bright.
Sorry, if you repeat that question for me one more time, I'll try to answer.
The question is, how can individuals, whether in a member of a faith community or in the healthcare field, take a first step towards collaboration in their own local context, given what we've established, that there's a lot of commonality across religions in caring for the environment and caring for the planet?
So I'd like to answer this on behalf of the Hindu community and, of course, my experiences at home on the religious side of it. Very often, these practical aspects of what faith calls upon us to do is lost in the mission of spreading the philosophy of the religion. And I think it would be very beneficial to the modern person, to the person that is now unifying their spiritual beliefs with practical living, to be able to, as I said, distill these essential beliefs from our religious scriptures and get it promoted in the sphere of temple sermons and congregation settings. So when we go, we start that way. You have your communities coming in, they attend service, and rather than 2 hours of just scripture without distilling, it becomes a practical place where we promote sustainable living, a reminder of what we're called upon to do in our practical lives as Hindus. We have to look to leaders as well to remind and instill and enforce to the average believer or the person on the street that is benefiting from this information, that we have duties that go beyond just saying, I'm a Hindu and I believe in God, and that's enough. I don't know if it's answering this question to the detail and depth that the asker might want, but I do think it's a first step to modify and to adjust the way we deliver religion to make it practical to the world that we're in today.
And
Thank
if I
you.
could just add to that, I've put a lot of things in the chat, but you know, for over several decades, a lot of people have been thinking about this issue, including Hinduism and Islam and Christianity and so on. So there's a lot of resources on the Forum on Religion and Ecology site. I loved your presentation, Tiffany. I just wanted to add that there's things we
you.
can now draw on, and I love your next generation energy for this. Thank you.
Well, it's 6:42, so we've gone way over. Melissa Primus, you wanted to ask a question?
And I just wanted to add to the comment from the question that you asked. One of the things we have to realize also is that we all have a responsibility as human beings. So yes, we are part of a church. Yes, we are part of healthcare. But if we realize our responsibility, you know, because we have a saying, I work in infection prevention and control, and we have a saying, infection prevention is everybody's business. And if we look at it on a broader scale, being humane, being practical, being em empathetic to others and to all living beings is our responsibility we all have in order to make sure we are able to push the message of sustainability, of improving lifestyles in simple ways, you know, taking it back to things that aren't so complicated, you know, as AI and stuff like those things are taken over. You know, sometimes these simple things in life is what we really need in order to spread a message or to create an actionable movement for a better way of life.
Thank you, Melissa. Deanna, I'm going to give you a last word, and then we'll close off at a quarter to the hour.
Thank you. And I want to tie in of what Tiffany said. What has happened, I think, is that we have started to look at what is good in very individualistic terms. So we don't look again at the community, but what do we share as humans? We share this same planet. We are on this same planet together. So we as a whole, as a community, as people together, it doesn't matter where you are from or who you are or what you are, we have to take care of this planet together and stop thinking in individualistic terms.
Thank you, Deanna. That's a good and positive note. Thank you, everyone who participated, the speakers, our participants. We had well over 100 people for the time, and people from the Caribbean and way beyond. If you have ideas for what we can do differently or continue this, please let us know. There is a WhatsApp chat associated with this education program, and you can also put messages in there on what you think we should be doing next. The upcoming session on Wednesday, April 16th, will be focused on how to win grants, a subject that should be of interest to a lot of people since we do need resources for our work. How to win grants will be the session April 16th, Wednesday, April 16th. So thank you all very much. And we are on a long journey, as Mary Evelyn told us. We have to persist in order to have a viable planet for ourselves, children, grandchildren. I have some grandchildren, so when I look at them, I think, you know, I've got to do something to make sure they have a future. So thank you all very much. Good evening.
Thank you.
Thank you. Thanks, James.
Thank
All the best
you,
to everybody.
James. Thank you, everybody. Thank you.
Thank you.
Thank
Good
you.
evening. Thanks
Thank
and
you, Deanna.
goodbye.
Good evening, everybody.
Bye-bye.